there are really only three main options. The first option is to have a denture, and these can either be acrylic or chrome. And there are indications for each of those. The next option up from that is having a bridge done. It's a little bit more invasive on the other teeth, and you do put more loading on the other teeth. So there are quite a few kind of factors that you have to take into account if you're going to go down that path. And the last option, or the most ideal option, is actually to have an implant placed. It's the best option because you don't really have to touch the other teeth, and you are spreading your chewing force or load in that area over more teeth, basically. So in my opinion, that's the most ideal option. If you do want some advice on what option will actually best suit you and your circumstances, just actually give us a ring, and we'll be happy to actually see you, talk through all of the options, the pros and cons, and you can make an informed choice for yourself.